We welcome you to our YouTube channel, Equation by Pharmacist Moms. This is the last part of our discussion regarding cardiac physiology. In this video, we will learn physiology behind cardiac arrhythmias or heart arrhythmias. Let's make a start. What's a normal heartbeat? Human heart is made up of 4 chambers, 2 upper chambers, that are atria, and 2 lower chambers, that are ventricles. The heart rhythm is normally controlled by a natural pacemaker, that is, sinus node, located in the right atrium. The sinus node produces electrical impulses that normally start each heartbeat. These impulses cause the atria muscles to contract and pump blood into the ventricles. The electrical impulses then arrive at a cluster of cells, called the atrioventricular or AV node. The AV node slows down the electrical signal before sending it to the ventricles. This slight delay allows the ventricles to fill with blood. When electrical impulses reach the muscles of the ventricles, they contract, causing them to pump blood, either to the lungs or to the rest of the body. In a healthy heart, this process usually goes smoothly, resulting in a normal resting heart rate of 60 to 100 beats a minute. What are cardiac or heart arrhythmias? Let's learn. Heart rhythm problems or heart arrhythmias occur when the electrical impulses that coordinate the heartbeats do not work properly, causing the heart to beat too fast, too slow, or irregularly. Heart arrhythmias may feel like a fluttering or racing heart and may be harmless. However, some heart arrhythmias may cause bothersome, sometimes even life-threatening, signs and symptoms. Heart arrhythmia treatment can often control or eliminate fast, slow, or irregular heartbeats. In addition, because troublesome heart arrhythmias are often made worse, or are even caused by weak or damaged heart, arrhythmia risk may be reduced by adopting a heart-healthy lifestyle. What are the different types of arrhythmias? Let's study. Doctors classify arrhythmias not only by where they originate, atria or ventricles, but also by the speed of heart rate they cause. These include tachycardia and bradycardia. Let's learn them by definition. Tachycardia refers to a fast heartbeat. It is a medical term for a resting heart rate greater than 100 beats a minute. Bradycardia refers to a slow heartbeat. In bradycardia, a resting heart rate is less than 60 beats a minute. Not all tachycardias or bradycardias mean that the person has heart disease. For example, during exercise, it's normal to develop a fast heartbeat as the heart speeds up to provide the tissues with more oxygen-rich blood. During sleep or times of deep relaxation, it's not unusual for the heartbeat to be slower. Let's discuss both of them and their types in detail. First are tachycardias in the atria. Tachycardias originating in the atria include atrial fibrillation is a rapid heart rate caused by chaotic electrical impulses in the atria. These signals result in rapid, uncoordinated, weak contractions of the atria. The chaotic electrical signals bombard the AV node, usually resulting in an irregular, rapid rhythm of the ventricles. Atrial fibrillation may be temporary, but some episodes won't end unless treated. Atrial fibrillation is associated with serious complications, such as stroke. Next is atrial flutter. Atrial flutter is similar to atrial fibrillation. The heartbeats in atrial flutter are more organized and more rhythmic electrical impulses than in atrial fibrillation. Atrial flutter may also lead to serious complications such as stroke. Upcoming is supraventricular tachycardia. Supraventricular tachycardia is a broad term that includes many forms of arrhythmia originating above the ventricles, that is supraventricular in the atria or AV node. These types of arrhythmia seem to cause sudden episodes of palpitations that begin and end abruptly. Next we will discuss Wolff-Parkinson-White syndrome. In Wolff-Parkinson-White syndrome, a type of supraventricular tachycardia, there is an extra electrical pathway between the atria and the ventricles, which is present at birth. However, symptoms may not be experienced until the person is an adult. This pathway may allow electrical signals to pass between the atria and the ventricles without passing through the AV node, leading to short circuits and rapid heartbeats. Following are tachycardias in the ventricles. Tachycardias occurring in the ventricles include: ventricular tachycardia is a rapid, regular heart rate that originates with abnormal electrical signals in the ventricles. The rapid heart rate does not allow the ventricles to fill and contract efficiently to pump enough blood to the body. Ventricular tachycardia may not cause serious problems if the person has an otherwise healthy heart, but it can be a medical emergency that requires prompt medical treatment if he or she has heart disease or a weak heart. Upcoming is ventricular fibrillation. Ventricular fibrillation occurs when rapid, chaotic electrical impulses cause the ventricles to quiver ineffectively instead of pumping necessary blood to the body. This serious problem is fatal if the heart isn't restored to a normal rhythm within minutes. Most people who experience ventricular fibrillation have an underlying heart disease or have experienced serious trauma. Next is long QT syndrome. Long QT syndrome is a heart disorder that carries an increased risk of fast, chaotic heartbeats. The rapid heartbeats, caused by changes in the electrical system of the heart, may lead to fainting and can be life-threatening. In some cases, the heart's rhythm may be so erratic that it can cause sudden death. A person can be born with a genetic mutation that puts him or her at risk of long QT syndrome. In addition, several medications may cause long QT syndrome. Some medical conditions, such as congenital heart defects, may also cause long QT syndrome. What is bradycardia? Let's discuss. Although a heart rate below 60 beats a minute, while at rest, is considered bradycardia, a low resting heart rate doesn't always signal a problem. If a person is physically fit, he or she may have an efficient heart, capable of pumping an adequate supply of blood, with fewer than 60 beats a minute at rest. In addition, certain medications, used to treat other conditions, such as high blood pressure, may lower your heart rate. However, if the person has a slow heart rate, and his or her heart isn't pumping enough blood, he or she may have one of several bradycardias, including sinus syndrome. If the sinus node, which is responsible for setting the pace of the heart, isn't sending impulses properly, the heart rate may alternate between too slow, that is, bradycardia, and too fast, that is, tachycardia. Sinus syndrome can also be caused by scarring near the sinus node, that's slowing, disrupting, or blocking the travel of impulses. Sinus syndrome is most common among older adults. Next is conduction block. A block of heart's electrical pathways can occur in or near the AV node, which lies on the pathway between the atria and the ventricles. A block can also occur along other pathways to each ventricle. Depending on the location and type of block, the impulses between the upper and lower halves of the heart may be slowed or blocked. If the signal is completely blocked, certain cells in the AV node or ventricles can make a steady, although usually slower, heartbeat. Some blocks may cause no signs or symptoms, and others may cause skipped beats or bradycardia. The last topic that we will discuss on the subject of cardiac physiology is premature heartbeats. Although it often feels like a skipped heartbeat, a premature heartbeat is actually an extra beat. Even though a person may feel an occasional premature beat, it seldom means he or she has a more serious problem. Still, a premature beat can trigger a longer-lasting arrhythmia, especially in people with heart disease. Frequent premature beats that last for several years may lead to a weak heart. Premature heartbeats may occur when the person is resting, or may sometimes be caused by stress, strenuous exercise, or stimulants, such as caffeine or nicotine. Arrhythmias may not cause any signs or symptoms. In fact, the doctor might find that the person has an arrhythmia before he or she does during a routine examination. Noticeable signs and symptoms don't necessarily mean that he or she has a serious problem, however. Noticeable arrhythmia symptoms may include a fluttering in chest, a racing heartbeat or tachycardia, a slow heartbeat or bradycardia, chest pain and shortness of breath. Other symptoms may include anxiety, fatigue, lightheadedness or dizziness, sweating, and fainting or syncope or near fainting. That was all about the cardiac physiology. We hope that it would be helpful for you. You can come up with more topics if you are having any queries in them. We are always here to welcome your requests. And don't forget to like the video and subscribe the channel if you have not subscribed it yet. See you.